This is Karen Ranzi, and I have with me my friend Laurie Evans, and I have brought Laurie Evans here to talk on the topic of circumcision. Now, Laurie has done a lot of research and she's written articles on the harm of circumcision for our male children. And I had asked her to write a chapter for my book, Creating Healthy Children, about circumcision and what is actually involved. And so chapter 4 of Creating Healthy Children is all about the harm of circumcision, with many resources so that parents can get help and understand why going against circumcision will be really helpful to their male children. And so I would like to introduce Laurie and ask her to talk about what is really happening when we circumcise our boys.
First of all, I want to say this isn't an easy topic. It can be very emotional, and I never thought I'd be doing this work. But I found out about it when I was teaching parents to massage their children, and I couldn't ignore it. So what most people don't know is that at birth, the foreskin is attached like the nail to the nail bed. So before they cut, they have to detach. And I ask people, when you rub your eye, where do you put your finger? On the eyeball or the eyelid? Mm-hmm. And if you were to remove the eyelid, you wouldn't have a moist internal organ anymore and nothing would be able to move, which is very similar. So I carry this 3x5 card with me to explain that what they remove grows to become 12 to 15 square inches of erogenous tissue. That's the inner mucus and the outer skin. And that becomes 20 to 50% of the outer skin. That's what they remove. So it serves protection during the diapering years. It has thousands of erogenous nerves, and it enhances the pleasure both for the man and his partner. And we're uncomfortable thinking of the sexuality that our newborn boys are going to have later on, but this is something all animals, the mother protects their child. Mm-hmm. And we have to focus on that maternal-infant bond. And as women, even if the husband is insisting on it, the father, we have to stand up wherever we can. And it's why it's so important before people become expectant parents that they discuss this, because it can create a lot of controversy.
Right. I know that when I was on book tour, I was at an event during one of my talks. I went into great detail about some of the information that you had taught me, Laurie, on the harm of circumcision. And there was a pregnant woman who emailed me recently, and this is 4 years later after that talk. And she had a second child a couple of years after I spoke about it. And she emailed me recently telling me that she would have circumcised her boy if she had not heard me speak about the harm. And that then, when she became pregnant with her second child, she went and she saw videos online about what really happens, and she experienced for herself what that excruciating pain might really be for that boy. And I recently got an email from her thanking me for giving her that information, because she feels like she saved her son, and that if he wants to have himself circumcised later, that will be up to him.
Right.
And so I'm grateful for you that you are out there giving this information, and that parents can understand that this is not something that is healthy. Because we're often told by doctors that this is healthy, that we need to do this.
Very few people know that during the 1880s here, when it began, that it was done to stop masturbation. They wanted it to hurt. And those are quotes from real doctors, and they did it to women back then. Every 2 years, our organization, No Circ, has an international symposium. and one of the women who has written a book about her own circumcision in this country, because in other countries they still do that to women in Somalia and Sudan, and we work with all these people and intersex children and boys who have hypospadias so that they are left as nature intended them to be and don't have to go this harm. But a very important topic that we have to discuss, because the rate, first of all, around the world, most men are intact. It's mostly the Jews and Muslims who do this, except for the United States and Korea. And so we have to talk about intact hair, because the rate has dropped in this country from about 85 to 50-ish%. And what happens at birth is that the foreskin doesn't retract because it's protective during the diapering years. And it should be the boy himself who begins the process of seeing if that tissue can move. What happens is you get doctors and nurses who don't know about intact hair, and they forcibly retract it, and that can cause bleeding and adhesions. So parents need to tell their healthcare providers, as well as grandparents, babysitters, whoever's going to be diapering that child, to leave them alone, clean what is seen. Clean what is seen. And then once they retract, and some boys don't retract until puberty, then it's the 3 R's. Roll, rinse, return. It's very simple. And there's nothing, it's meant to be there, and we got to just leave it alone.
Exactly. Well, thank you. That's very important information that I think that people should be aware of, especially women who are pregnant and want to do the best for their children. And if we're following attachment parenting, following the emotional, physical, mental, spiritual needs of the child, we want to respect the child on all levels. And this is something that we absolutely must know. We must research about it. As I said, Laurie wrote chapter 4 for creating healthy children. You'll get many resources if you read that chapter. Are there any websites in particular that you would recommend?
There are NoCirc.org, IntactAmerica.org, and ColoradoNoCirc.org. I want to make one other very important point. As more and more boys are intact, if they get a urinary tract infection, I just had a parent the other night at the concert I attended. His son is 15, and he said the doctor's trying to circumcise him because he's not retracting yet. He said, I want you to ask that doctor if he's circumcised. Could you imagine if something's wrong with one of our daughters, we're going to take them to a doctor for surgery? So the thing is, I asked them, ask the doctor if he's circumcised. The doctors don't know enough about this topic, and I can't impress upon people enough. If they need a second opinion, if they're concerned about anything, watch the videos so they really understand. One mother told me it was a nightmare to see her son's raw wound afterwards and not know that that's really what it was going to be. Mm-hmm. And she has to live with that for her whole life. I had a mother of a 2.5-year-old about a month ago say her son's having painful erections. What do you say to these people once the harm is done? And so many mothers, they say, well, I'm going to leave it up to my husband, or I want him to look like his father. And I said, when they started it here in the 1800s, the fathers were intact, the boys were done, and we have to have a transition generation where, so those websites, we can put them in touch. And I just want to say I'm a Jewish woman with a 23-year-old intact son. And when people ask me about my son's religion, I say his religion is in his heart and soul and not in his genitals. As we say, babies are born perfect. We need to leave them that way. And today's parents say no to circumcision.
Thank you, Laurie.
My pleasure. Thank you so much to Karen. It's controversial, but she does it because she cares about the baby boys, our precious newborns.